Well, a warm welcome to this update, Monday the 13th of June. Now, we've got an increase in BA.4 and BA.5 variants, these very transmissible variants of Omicron in the United Kingdom and probably in the United States and other parts of the world as well. Let's just have a look at the headlines on that first. So there's basically been uptake in COVID hospital admissions in England, and we'll just look at that actually briefly now. So this is the overall situation in the sort of English UK dashboard at the moment. But we do notice that the people testing positive is going up. Now, that's not a great indicator because there's not many people being tested and not that many tests being reported. And we do see deaths continuing to go down, which is remarkably encouraging. But there's a slight increase, well, actually a reasonable increase, 33% in the week in hospitalisations. Now, this is an increase on a small number, so I'm not really massively worried about it, but it's definitely a significant percentage increase that we're seeing. And if we actually look at the healthcare in more detail for the UK figures, we do see that patients admitted to hospital have gone up in the last month, so we see a slight increase there. Patients actually in hospital, again, slight increase in the last month. Again, this is really attributable to the BA.4 and 5. But thankfully, when it comes to intensive care, we're not seeing an increase. Very, very slight, but I don't think that is a very significant difference. So this is definitely something that's happening. Now, is this good news or is it bad news? Well, it's kind of what we expected, really. What we're seeing is lots of new variants, more reinfections, lots and lots of reinfections, but the number of people getting ill continue to go down, and I'm expecting this trend to continue. More transmissible variants, or the currently very transmissible variants, carrying on, causing a degree of reinfections, mostly mild infections, with fairly low levels of hospitalisation in comparison to the number of people that are being infected, but I will be giving evidence for that. Office for National Statistics agrees. Early sign of a possible increase of COVID-19 in England and Northern Ireland. Scotland and Wales, it's a bit difficult to tell. But the key thing is, at the moment, this is being caused by the Omicron subvariants BA.4 and BA.5, which is spreading more rapidly than the BA.2, which of course spread more rapidly than the BA.1. But overall, not too concerned about it. Should we be taking any dramatic actions about this? I really don't think so. Official bodies are still advising that we try and prevent infection, that we try and save ourselves from being infected. But the hospitalisations, as we've seen, aren't dramatically increased, just a small amount. Now, this is the graphic from England here. So again, this is Office for National Statistics, bit out of date. This will be a bit higher now. So this will trend up somewhat, hopefully not too much. These are people testing positive. So the conclusion is that BA.4 and 5 are in the ascendancy. They are going up, which took over from BA.2, which took over from BA.1, which took over from Delta, which took over from Alpha, which took over from the original wild strain, as these become more and more transmissible. It is an impressive evolutionary pattern, increasing transmissibility. Delta was more pathogenic. Alpha caused a lot of problems because there was low vaccination and immunity levels at the time. But these becoming progressively more and more transmissible. Quite impressive, really. The main reason for the increased transmissibility of the Omicron BA.4 and 5 appears to be the fact that it's causing reinfections rather than the fact that it's intrinsically more transmissible. So if we look at the Omicron waves in the United Kingdom now, so this was a BA.1 wave there, a BA.2 wave there. What's this wave going to look like? Probably not too too big in terms of hospitalisations. I would expect it to go down fairly quickly. Now, my main reason for saying that is from South Africa. I'm going to show you that data shortly. These emergencies, by the way, about almost a fifth of cases are probably caught in hospital. So this is somewhat of a skewing of the data. This study here estimated 19% of cases actually caught the virus in hospital. So South Africa again, still haven't heard anyone answer this question. Why are these variants emerging in South Africa? It does seem strange that the Omicron and then the variants carry on emerging in South Africa, or first detected in South Africa, probably emerging in southern Africa somewhere. Unclear why that is. But the BA.4 and the BA.5 seem to go together. They're both very transmissible, and they both evade immunity from previous vaccination and infection, which is why they're spreading. So they're able to spread through the vaccinated and the previously infected population. And the crossover point, so BA.4 and BA.5 became more prevalent at Jubilee weekend, where there was lots of social mixing, of course. Huge social mixing over the Jubilee weekend, which was the 4th to the 5th of June. So now we can say with some certainty that there's more BA.4 and 5 than there is BA.2. Now, South Africa has just been through this. Now, let's just look at some South Africa data here to illustrate this point. So here we have cases in South Africa, which you can now see. So very pronounced waves in South Africa. But this here, this in South Africa was the original Omicron here. These are the previous waves, the original wave. That would be Delta. I'm not sure if they had Alpha or something else in South Africa. I can't remember. But they're the South African waves, quite distinct. Anyway, that was the Omicron wave, the original Omicron wave. And this is their Omicron bounce. And this Omicron bounce in South Africa was caused by BA.4 and BA.5, and as we see, it's way smaller than the original Omicron wave was. And when we look at the level of hospitalisations in South Africa, thankfully we see that they didn't go up too much. Remember, this is for the whole country, so there was some increase, but not a pronounced increase. And if we look now at the people in South Africa that are actually in hospital and being treated, we see that current hospitalisations, there's just over 2,000 people with COVID diagnosis in South Africa. And the interventions here, so interventions for currently admitted patients, oxygenated 257 patients in the entire country, 68 ventilated. So we see that it hasn't had a profound effect on South Africa, a particularly worrying effect on South Africa. And just one last South Africa figure here to show you South African deaths. So here we see, this is the BA.4 and the BA.5. So these were the deaths from the original Omicron here, the characteristic waves of South Africa that we saw. This was the Omicron wave, and this is the original Omicron wave, and this is the BA.4 and 5 Omicron wave. So we see that while there are some deaths associated with it, it's way, way lower than all of the previous waves and way, way lower than the Omicron wave itself, which of course is pretty reassuring. And it'll be very similar to that in the United Kingdom and the United States. I don't think there's any reason to think otherwise on that. And we've seen this repeatedly. We've followed waves through various countries. This is a pattern we're now really quite familiar with seeing. So BA.4 and 5 variants had already swept through South Africa. Okay, I say no major problems relatively to the other waves. Fairly small numbers. Despite multiple reinfections, this is reinfecting people that have been infected in previous waves. So previous immunity has not protected against BA.4 and BA.5 infections. But deaths in South Africa are only around a tenth of the peak of previous waves. Less people getting sick, less people getting hospitalised, as we saw. And reinfections will increase immunity. Now, here you could say, well, just a minute, previous infections didn't prevent against infection with BA.4 and 5. True, there's reinfections, but they are less severe, with way less hospitalisations and way less deaths. So that is what I believe is going to happen in the United Kingdom and in the United States. I'll just have a quick look at the data from the United States before I give some other evidence for the overall contention of today's video. So here we have infections. These are cases diagnosed in the United States, cases, again, of course, based on very limited testing data, really. But there is an increase, which is interesting to note. It's in the United States. Now, in terms of deaths in the United States, thankfully, well, they're still there, but they're much lower than they have been. They're the deaths in the States there. Hospitalizations in the States is on this slide here. Has gone up a bit, but now starting to go down. So what I suspect, we ummed and ahed about this, would the BA.2 12.1 be more infectious than the BA.4 and 5? Turned out the BA.4 and 5 has won that race, if you want to put it in that way. And it looks like there might have been, the infections of BA.4 and 5 might have spread through the States more or earlier than we had thought, because the hospitalizations there possibly do see, well, they are certainly going down somewhat, the overall hospitalizations. Let's hope that's a trend that that continues. Now, the reason we're not so sure is the data is really quite out of date for the States. So we're due some more pretty soon, but this is the data from the States. That's the 4th of June data. And we see the BA.4 and 5, while they're increasing, are relatively low. So was that hospitalization slight increase caused by the Omicron BA.2 12.1, or is it just that the data, the reporting is a bit out of date in the States? But either way, early signs there that the hospitalizations could be already starting to decrease. Overall, I see this encouraging. Now, I just want to give a paper here. Now, this paper here is actually from December 2021, but it's quite relevant for reasons I'll make clear in a minute. So, severity of SARS coronavirus 2 reinfections as compared to primary infections. So this is December 2021, which, remember, was before, well, that was just sort of the start of the Omicron towards the end of the Delta, so largely Delta. Now, this is from the national cohort in Qatar, reported to the New England Journal of Medicine. Large national cohort, 353,000. They identified 1,304 people reinfected, largely with Delta, of course. So there's way more reinfections with Omicron than there was with Delta. But of course, Delta was much more pathogenic, causing more severe illness. Reinfections were rare and generally mild, according to this paper. And remember, this is reinfections largely with Delta, which is a more pathogenic virus. And yet, they were still generally mild. Now, the risk of reinfection with Omicron from the Office for National Statistics in the UK, it's 8 times. So risk of reinfection is 8 times compared to Delta times. So way more likely to get reinfected. Lots of people are going to get reinfected. But even with the more severe Delta, reinfections had 90% lower odds of resulting in hospitalizations or deaths than primary infections. So with Omicron, I would expect it to be even higher, significantly reduced risk of hospitalizations and deaths, probably greater than 90%. So that's what we're seeing. People are getting sick. There is a slight increase in hospitalizations. There might be some increase in deaths, as we saw in South Africa. But the vast majority of people that are getting reinfected are not getting very sick, and they're not being hospitalized. And this is going to increase overall immunity. Now, it's not stopping, these previous variants are not stopping people getting reinfected, but they are preventing them getting ill. So this is, in my mind, a big move towards the endemicity we've been expecting for some time now, where we are going to see repeated reinfections. So it seems likely that most of us for the next few years are going to be reinfected with some SARS coronavirus 2 variant on a fairly regular basis. Every year, every 2 years, something like that. We don't really know, but it's going to be more of an inconvenience than a threat. And it doesn't. No government seems to have any appetite for taking restrictive measures other than the basic public health advice. But it is causing immunity, which is preventing serious illness and death, which is the important thing. So I'm going to close on that note, which I consider to be optimistic, and thank you for watching.